Thank you, Chair. The ACDP welcomes this debate about the TB pandemic, particularly when seen against the COVID-19 outbreak. And whilst there are understandable global alarm and concern about the coronavirus with various countries in lockdown, it is important to see this virus in perspective in South Africa, without, of course, detracting from its seriousness. As of yesterday, there were around 4,800 deaths from the coronavirus worldwide. Compare this to the staggering levels of TB in South Africa. Chair, it is the leading cause of death in South Africa, with 63,000 people dying in 2018. That is approximately 172 persons today. Why then is there not a similar outcry and even outrage about the levels of TB in our country, particularly as it is fully treatable as a bacterial disease? We can and must do more. At the forefront of the fight against TB are, of course, the brave doctors and nurses at both primary and secondary level. The ACDP recently visited the Brooklyn Chest Hospital, a center of excellence in the treatment of TB. And we want to pay tribute to the nursing staff at this facility and indeed at other facilities across the country that are committed to treating patients with TB, including DR and, of course, the extreme drug-resistant TB patients. Poverty clearly contributes to the spread of TB, as many also prove to, and that may be the case as well with COVID-19. Many of our impoverished living in crowded housing conditions, having to use crowded buses, taxis and trains to commute. And of course, the poor less likely to seek care or complete the course of medication. Poor nutrition can also reduce one's chances of being cured. However, because TB is largely curable, it is, from the ACDP's perspective, incomprehensible that so many South Africans are still dying from it. In addition, those who suffer from TB and or HIV are at higher risk of contracting COVID-19, given their compromised respiratory and immune systems. So what should our response be? We support calls to clean our hands, wash soap and water, cover our mouths when coughing and sneezing, and of course building our immune systems and getting quality sleep and exercise. And of course, if you're feeling sick, call the helpline, get aid. This will, of course, reduce the spread of coronavirus and TB. And lastly, in addition to these common sense steps and precautions, we who are believers in this nation need to emulate Jesus, particularly who taught us to love and care for those who are sick, particularly the sick and suffering. Let us not allow fear and panic. Remember God's word in Psalm 91. If you place your trust in the Lord, no evil shall befall you, nor shall any plague come near your dwelling. Take precautions, do not be fearful or anxious, for God has not given us a spirit of fear, but of power and of love and of a sound mind. I thank you.